Hello my dear friends, once again welcome to the new session of Hospital and Clinical Pharmacy. Myself Ms. Malvi Rajendra Bhavsar, M. Pharma in Pharmaceutics. So today we are going to start with a new chapter, Surgical Dressings and Hospital Supplies. So after watching this, student will be able to learn different surgical dressings, different hospital supplies and different types of fibers and fabrics which are used as a surgical dressing. So first we will see what are the surgical dressings. Surgical dressings, these are the dressings which are applied during the surgery to prevent the wound from the infection. BPC, that is British Pharmaceutical Products, describes surgical dressing under following categories. First category is fiber, plain and medicated. Then second is fabrics, plain and medicated. Third is rubber and oil impregnated fabrics. And D, compound dressings. So first we will see fibers. Cotton is most extensively used natural fiber. Wool. Then jute and wool fibers are also used. Fabrics. Most fabrics are cotton based. The fabrics are in the form of bandages, plasters. They are often medicated to convert them as antiseptic dressings. Gauges are the cotton fabrics. Then next one is adhesive bandages. Adhesive bandages that are easily fastenable. They are waterproof, act as a protective dressing, gives a mechanical support and are mostly medicated. And fourth is compound dressing. Compound dressing consists of cotton wool or wood wool enclosed in gauze to form a pad. So first we will see absorbent cotton. It consists of hairs from the cotton seed. Each hair is unicellular and tubular. It is flattened and twisted. It has thickened edge and rounded apex. Natural hairs are non-absorbent due to the presence of sticky substance. The ginning process helps to freeze the hair from the seeds. Fatty matter is removed by boiling the raw material with a caustic alkali under the pressure and fat is saponified. The cellulose of the hair remains unaffected. The saponified fat is washed off. Fibers are bleached with bleaching powder, treated with dilute acid and are again washed for removing all the soluble matters. Test for absorbent cotton. First test is cotton is insoluble in 4 to 5% NaOH solution. Second test, it is soluble in mixture of sulfuric acid 38 volumes and water 17 volumes. Then surgical dressing fabrics. These are woven from the cotton yarn and are plain weave. Standards for these are the BPC recommended, British Pharmaceutical Codex recommend the exposure to 63 to 67% relative humidity and 18 to 25 degrees Celsius, minimum 6 hours before weighing. The closeness of weave is given by threads per inches. Tensile strength denotes rupturing of fabrics. Moisture content is done by weighing a sample of 5 grams before and after drying at 100 degrees Celsius. Then water soluble extractives. So how we can calculate that? We have to take a dried sample which is derived from moisture determination and wash it in the same way as for the foreign matter. Collect the loosened fiber on the seam, dry them at 100 degrees Celsius and weigh. This test is applicable to absorbent gauge and absorbent lint. Elasticity. This test is carried out by holding an end of the material in the fixed grip and other end in movable grip under the tension of 6 lb per inch, width for 1 minute. The stretch strength is measured on releasing the material and allowing the contraction for 5 minutes. The measure of length is taken again. Then is absorbency. Absorbent gauge. Ribbon gauge, a piece weighing 1 gram is taken and is compressed to the volume of 20 ml. The material is placed on the surface of water at 20 degrees Celsius by the means of forceps. The time taken by it to sink or become saturated is recorded. Leaf and shell Cotton fabrics are free from leaf and shells. Absorbent gauze. It is of open texture and made up of cotton. It has a soft and flimsy appearance. It can be medicated by suspending the unmedicated fabrics in the solution or a suspension of suitable medicaments in suitable solvent, whereupon product is pressed and dried. Then bandages. These are prepared in various width and in continuous length without any joint. The edges occur parallel to wrap and there are no loose thread in the bandage. Plaster of Paris. It is a bandage. It is a cotton treated with calcium sulfate, extricated and suitable adhesives. Its 85% of total weight is adherent to calcium sulfate, that is CaSO4. Extricated is reasonably free from the loose powder. Cotton crepe bandages. It is elastic bandage of cotton or cotton rayon. Elasticity is to obtain by wrap thread. Then adhesive bandages. Example of adhesive bandages: zinc oxide self adhesive plaster. And the standards for these bandages are number of threads per inch in the wrap per wrapped, weighings per square yard, count, tensile strength, elasticity, weight of adhesive mass per square yard, weight of dressing per square yard, continuous length, no joints, and clean fabric. Then compound dressings. That tissue, these are the cotton wool, plain or medicated, or cellulose bedding in the form of thick layer enclosed in the tubular absorbent gauze. The different types of tissue are gauze and cellulose bedding tissue gauze and capsicum tissues. Standard. The gauze should have no fewer than 12 threads per inch in the bed. A specified area is required for 1 pound of the dressing. These are the tests for the absorbent cotton wools. Category of that is surgical dressing. The pharmacopoeia standards. Different tests are performed, which includes identification test, acidity or alkalinity test, surface active substance, NAPS, coloring matter, water soluble substance, ether soluble substance, sulfates, ash, loss on drying and packaging. Other hospital supplies include IV sets, catheter, vials and syringes. Thank you friends. Thank you for your patience listening. Thank you. Thank you very much.